a concise process. Sure, there will be a lot of elements that fit that, but there's so many things that fall out. If you make the mistake of putting knowledge workers in a knowledge area through a McDonald's drive-through, if you will, then it really messes things up, which is what we have going on here. We've got to a point as a society where we realize that we can automate things and mechanize things and do this assembly line and do all these great things to make things more efficient, but we're trying to apply it to everything and it doesn't work. It's
right.
Basic management. And so these people who claim to be all these management people, they should know that. And they're cramming things into a square when it's not a square peg.
Well, my thought about the whole health insurance industry as it stands today, not what it used to be when it was true catastrophic indemnity insurance, but as it stands today is really the patient and the doctor are cogs in their system. They're profiting off of this system. They're profiting off of patients and doctors. And we've all sort of, bought into this because seems to be where we've gone and where we went, and this is how it's done. But really not. I mean, I
don't know if people have bought into it or if they just all feel like it's an overwhelming problem that they just feel they're sucked into. Well,
maybe I shouldn't say bought into. Like there's nothing that they can do. There's nothing that they can do. So now it's like, well, this is how it is, right? But this is not how it should ever be for the patient and the doctor.
Well, but you've come up with this huge solution. I mean, this great solution to try to solve some of these problems.
That's correct.
And I want to get to that. And I also want to talk about the fact that we will always have, other developed countries do take care of everybody. And this is our solution to try to get everybody onto the bandwagon. But we are still so much more expensive than everybody else too. So that we have to do it different if it's ever going to work. But with your solution, do you have ideas on how to take care of the people who can't take care of, there's a lot of people that never could afford health insurance. So how does your solution look at a big picture of how to take care of everybody, or just solving the problem immediately of the people who just can't afford insurance now and starting to move towards a better system?
So I would say that we want to flip the system. We want to use the wedge of health freedom to flip the system back. And one of the things that I like to just point out to people is there are lots of countries that have coverage for everyone, right? Coverage. But the only thing about healthcare that really matters is the care. And if the coverage is so expensive that you don't even have your own money left to get the care that the coverage says you can't have, then we have a problem. And the only reason people get coverage insurance at all is because they're worried that they wouldn't be able to get care. So when you have developed a system like we have here in the United States where the coverage is so expensive and the care there's no guarantee that you'll get anything.
Well, everybody's afraid to go to the doctor. I mean, right. Even people with money are like, oh, I don't know if I want to go.
That's right. That's right. So we've developed a system where we're paying these health insurance companies all this money to not provide us any care, and then we have less money in our pocket when we actually need care, and then they say no. And so, it's a bad situation that we've developed, and it is not patient friendly. It is not where healthcare should be.
It's not doctor friendly either from the way that these doctors are being affected either.
That's right.
Just health, their mental health.
Right. Yes. Because it is a juxtaposition for them. It is a conflict that they cannot resolve between what they know they should do ethically and what they seem to be allowed to do as a result of the system that has been built around them.
So what do you have as a solution? How are you dealing with this unbearable high costs, and how are you making it work for people? And from what I understand, you have like 160 different clinics that are involved and lots of doctors. So people are starting to jump on this bandwagon that you have going on and really realizing it's a possible thing that can really work. So can you explain what your mission is and how you're doing this? And just give us your mission and we'll go from there.
So just to be, let me just start that again.
That's okay.
So the mission of the Wedge of Health Freedom is to bring back the patient and the doctor together again in an affordable, confidential, and patient-friendly relationship. It's essentially to bring healthcare back to where it belongs, where it used to be, where it always was, and where it should be for the patient and the doctor, as an ethical practice of medicine and as a caring relationship between the patient and the doctor. So the Wedge of Health Freedom is two things. It is our branding of a free trade zone in healthcare. So today we have healthcare. We look at it as this big circle of healthcare, right? But within healthcare today, operating currently, are doctors who are freely practicing. They are not practicing under managed care contracts. They're not practicing under government directives for Medicare and Medicaid. They are freely practicing affordably with their patients. And but we know that the American public doesn't really know that this exists, and so it's basically invisible. So the Wedge is our branding of this space in healthcare that's happening today, with the idea that the public can start to see it. And then once they start to see it, we want it to grow. We want it to grow not only in patients who decide to come and find a doctor practicing in the Wedge, but also in doctors that decide to come into the Wedge and be that kind of a practice. So the Wedge has 8 principles, which include transparent pricing. All patients are welcome. You have true patient privacy. There is a confidential patient-doctor relationship. So there are 8 principles in any practice who follows those 8 principles, has opted out of Medicare, and doesn't sign any contracts with insurers, is eligible to just come onto our website and sign up to join. And then their clinic will appear on our map. Their practice will appear on our map of practices that then any patient can come and look and see if they can find this kind of practice in their neighborhood or nearby or within range that they're willing to go. And so, the whole idea here is to help patients and doctors escape the current healthcare system, which does not treat patients and doctors the way this entire relationship in the practice of medicine was supposed to be, as an ethical, confidential, patient-friendly, caring relationship between the patient and the doctor, where the patient really knew that the doctor was their advocate. The patient really knew that the doctor wasn't there to ration their care away, wasn't there to follow the directives of a payer, the government or a health plan, wasn't there to limit their access to care, but would really truthfully tell them all the options and then would lay out all the prices. And as a result of as a result of not having all of that managed care regulations that they would have to follow, as a result of not having contractual obligations, the prices could be really affordable. And that's really what that's what we're doing with the Wedge.
Okay, I have a question. Now, let's say for everyday kinds of things, I would really want to go to something like the Wedge where I'd pay just whatever the fee is. I have to do it anyways with an HSA or a high deductible plan. But what about if you have something catastrophic like cancer or you need a heart transplant or something like that? Do you have a means for doing what catastrophic insurance used to be?
So to be very clear, I need to say this very clearly. The Wedge does not take the place of insurance. So the Wedge is not a form of insurance whatsoever.
I know. So if we wanted to use the Wedge, we would still need catastrophic insurance.
Or not. So if you want to be insured, you still need to have insurance, or you could use a health sharing organization. Yes. Or if you're publicly subsidized, if you're in Medicare or Medicaid, all of those folks, whether they are insured, uninsured, or publicly subsidized, can come into the Wedge and find a doctor who truly works for them at an affordable price and confidentially. So they can say anything and not worry that it's going to end up on the health information exchange on the grid, right? So
Sure.
Anybody can come in. But we do not discourage you from having insurance, because we really believe that, catastrophes happen. Why not have a catastrophic?
Well, I just wish there was more, like, I see a solution that could come forward that could say, okay, let's have catastrophic health insurance that is just for that. And then the other parts all go through this wedge kind of scenario. And I mean, develop it into what it used to be.
Right. And in the wedge, we already have specialists that have signed up. And so, a lot of times when you get to catastrophes, you're really talking about things that you use specialists for, right? So there's no reason that you can't use a specialist in the wedge. And because you can use your insurance and you can pay out of network, or you can use your HSA and you can use that to pay for that cost. But eventually, so here we are, we're about maybe 4 weeks or so out of having our map put online. We've got about 150 or so practices. There are specialists, there are primary care, there's a midwife, there's a psychiatric, there's psychiatrists and mental health clinics, and there's surgeons. And so they're all, all of those kinds are there. And we want to get everyone who's already practicing what we would call the wedge way. We want to get all of them from all around the country on our map. And then we want to drive people from everywhere to the map, because this is where they can get affordable, confidential, patient-friendly care.
So now,
right?
how much could you save by going through the wedge, where you have a doctor who doesn't have all the bureaucratic crap that they have to deal with, versus going through the normal insurance, nightmare?
Right. So there are several things. There's at least two different ways to think about that. So some of the practices in the wedge are cash based. In other words, they're all cash based, but these are cash practices where they have a list of what everything costs. Everything has its own itemized cost to it. So it's an itemized list, and it's all very public. And so you can go and you can, pick and choose, and you can see what your doctor's visit is, that sort of thing. There's also the direct primary care type of practice, which is also cash-based, but you pay a certain amount per month, depending on how old you are. And then they're available to you 24/7. They're available by email.
Wow. Okay.
Yep. You can call them. They are your doctor. All of these can be your doctor. But when you're paying a doctor, a certain amount per month, then you have other services that are attached to that. It's not just coming in to see them. It depends on which direct primary care you're using, because they're all independent. So they all are, they do their own thing. But they often offer medications at a much cheaper price than you can get them, because they buy them in bulk. Or they might offer services like, stitches or throat swab.
So you could realistically just pay a doctor a monthly fee, which is a lot less than your insurance, and you could get some kind of catastrophic coverage separately and be way better off and get way better service.
That's right. And it wouldn't be the catastrophic coverage of today. So, as we
exactly, it would be
right?
different. It would be a very streamlined. If I get cancer, if I have to do something major, otherwise all your daily and livable type stuff, you would just have your doctor.
That's right. We have a slideshow, and on our PowerPoint, we have one slide that shows a triangle to just show you how this would work. So it shows a triangle, and at the top of the triangle is the payer. And that the bottom two are the patient and the doctor at the points of the triangle, right? And everybody has to go up to the payer and get permission or send money or, appeal or, whatever, send data, everything going up to that payer in this triangle. And nobody is exactly sure what's going to happen within the triangle. How much is that payer going to give? Is the payer going to allow it or not? In the wedge, what our plan is to use the wedge to disassemble the triangle. Disassemble it so that it is 3 parallel lines. And one of those lines is patient to doctor, another one is patient to hospital, and the third one is patient to insurer. And when we get to that point, then we will have catastrophic indemnity insurance that does not interfere with the patient to doctor line or the patient to hospital line.
Yes.
They will send the money to the patient, who will then distribute it as they wish to the doctors and hospitals of their choices for the procedures that they have decided to allow, and according to the negotiation that they have with the hospital.
And it unbundles it and makes it less confusing, because right now, with the way everything is so jammed into the wrong box. It's so